What if a class of drugs, widely known for treating a specific sexual health issue, could also help people live longer and healthier lives? In recent years, several large-scale studies have hinted at exactly this possibility. Medications like Viagra, medications like Cialis, these drugs, known as phosphodiesterase type 5 inhibitors, are now the subject of intense scientific inquiry. Researchers are investigating whether their use is associated with a lower risk of heart attacks, a reduced chance of death from any cause, a decreased incidence of Alzheimer's disease. The preliminary results are compelling and have generated significant discussion. However, it is crucial to understand that the evidence, while interesting, is not yet definitive. In this video, we will examine the science in plain, accessible terms, looking at both the promise and the limitations of the current data. To understand the longevity hypothesis, we must first understand the basic mechanism of PDE5 inhibitors. This class includes drugs like Sildenafil, brand name Viagra, Tadalafil, brand name Cialis, and vardenafil, brand name Levitra. Their primary function is to block an enzyme called phosphodiesterase type 5, or PDE5. PDE5 breaks down a signaling molecule named cyclic guanosine monophosphate, or cGMP. By inhibiting PDE5, these drugs raise cGMP levels in smooth muscle cells. cGMP relaxes smooth muscle, leading to vasodilation. Wider vessels mean improved blood flow. While famous for increasing penile blood flow, PDE5 is not exclusive to one organ. It is found in the arteries of the lungs, the heart, the kidneys, and even the brain. So the effect is systemic, impacting many vital organs. A key difference is duration. Sildenafil typically lasts 4 to 6 hours. Tadalafil can last up to 36 hours. This matters later. The interest did not emerge from a vacuum. It is rooted in vascular decline. With age, vessels stiffen, arteriosclerosis, and endothelial function deteriorates. A healthy endothelium regulates blood pressure, prevents clots, and manages inflammation. When it declines, blood flow to the heart and brain can be compromised, fueling age-related disease. PDE5 inhibitors promote vasodilation and may bolster endothelial resilience. Researcher Mikhail Blagoslani proposed that aged tissues are hyperfunctional and tense, and these drugs help them relax. He suggested low-dose, long-acting Tadalafil might keep tissues more relaxed and youthful. That reframed PDE5 inhibitors from symptomatic treatments to potential preventative tools. The hypothesis catalyzed large-scale analyses of patient records. If vascular decline drives aging, a safe vascular support drug could have far-reaching benefits, cardiovascular and cognitive. So what do the human studies actually show? The most robust and consistent observational evidence comes from cardiovascular research. Multiple large studies, analyzing data from hundreds of thousands of individuals, report better outcomes and lower mortality. This forms the strongest pillar supporting the longevity hypothesis. Key early study, Karolinska Institute, published in JACC 2017. They examined men who survived a first heart attack and compared ED treatments. Men using PDE5 inhibitors had a 33% lower risk of death. Benefit was dose-dependent. The more frequent the use, the lower the observed mortality. A 2023 meta-analysis pooled 16 studies and 1.26 million subjects. It showed lower major cardiac events and lower all-cause mortality. Recent data often highlight potential advantages of long-acting Tadalafil. In 2024, Kloner and colleagues reported 44% lower all-cause and 55% lower cardiovascular mortality with Tadalafil. A UTMB study examined over 500,000 men. Tadalafil use was linked to a 34% lower mortality, Sildenafil 24%. These large, consistent signals are why cardiovascular researchers are paying close attention. Following the cardiovascular data, attention turned to the brain, specifically Alzheimer's disease. Impaired cerebral blood flow is a known risk factor for dementia. If these drugs improve blood flow systemically, they might also enhance brain perfusion. A landmark 2021 study led by Feixiong Cheng at the Cleveland Clinic flagged Sildenafil. A computational scan of 1,600 FDA-approved drugs ranked sildenafil highly for AD pathways. They then analyzed over 7.2 million insurance records. Sildenafil users were 69% less likely to develop Alzheimer's over 6 years. In vitro, sildenafil promoted neurite growth and reduced toxic tau. A 2024 UK study reported an 18% lower AD risk among PDE5 users, with dose response. A 2024 meta-analysis pooled 5 studies with 880 patients. It found a hazard ratio around 0.47 for AD among sildenafil users, smaller than the initial 69% but still a remarkably strong signal. These findings are exciting, but observational, so they demand healthy scientific skepticism. Which brings us to the critical caveat behind all of these results. Despite the striking statistics, nearly all of these studies are observational. They mine existing data, insurance claims, and electronic health records to look for patterns. They can detect associations, like taking a PDE5 inhibitor and having a lower risk of death. But they cannot prove causation. The biggest challenge is healthy user bias. Men who seek treatment may be healthier, more proactive, more socially engaged, and better resourced, factors that independently reduce heart and brain risks. Researchers adjust for age, income, education, comorbidities like diabetes and hypertension, but adjustments are never perfect. Some differences are unmeasured. This is why randomized controlled trials are the gold standard. Randomization balances known and unknown confounders. If outcomes diverge, we can infer causation. Until such trials are done, the PDE5 longevity signal remains association, not proof. That is the major caveat. While the potential benefits are intriguing, we must clearly assess risks and side effects. Used as prescribed, these drugs are generally safe for most men. Common effects are mild and stem from vasodilation, headaches, facial flushing, nasal congestion, indigestion, and sometimes muscle or back pain with Tadalafil. Rare but serious: sudden vision loss, nausea, or sudden hearing loss. Priapism, an erection lasting over 4 hours, requires immediate medical attention. Absolute hard stop: never combine with nitrates for chest pain, like nitroglycerin. This can cause a life-threatening blood pressure drop. Use caution with certain alpha blockers, antifungals, and some antibiotics due to interactions. Early melanoma concerns were likely confounded by sun exposure and screening. Current evidence does not support a causal link. Side effects are usually manageable, but risks and contraindications are real and must be weighed against any unproven longevity benefit. So, where does this leave us? After reviewing mechanisms, the observational data, and the caveats, PDE5 inhibitors are not proven anti-aging drugs. They do not directly target core hallmarks like DNA damage, telomere attrition, or epigenetic drift, unlike experimental agents such as rapamycin. It is more accurate to view them as vascular resilience agents. The consistency across massive datasets is the most persuasive element. Lower mortality, fewer cardiac events, and reduced Alzheimer's incidence. But healthy user bias may explain part, or even all, of the effect. For men with a medical reason, ED, BPH, or pulmonary hypertension, the emerging signal is a legitimate bonus to discuss with a physician. For healthy men considering off-label use purely for longevity, the evidence is suggestive but not conclusive. Proceed with caution and medical guidance. Prevention demands a high bar for certainty. PDE5 inhibitors do not meet that bar today. The honest verdict: promising associations, plausible biology, real risks, and a need for trials before broad preventive use. The current mix of exciting associations and uncertainty leads to one conclusion: we need better data. Observational studies have generated a plausible hypothesis that now requires randomized trials. Definitive answers demand large, long-term, randomized, placebo-controlled trials. They must track hard outcomes: heart attacks, strokes, dementia, and mortality. These trials are expensive, complex, and require years of follow-up. Fortunately, the scientific community recognizes the importance, and trials are being planned. A Phase 2-3 trial for Alzheimer's prevention with sildenafil would be pivotal. A long-term RCT of daily low-dose Tadalafil for cardiovascular endpoints could change practice. If these trials confirm the observational benefits, we could gain an evidence-based prevention strategy. This story illustrates science in motion, mechanism to serendipity to big data to rigorous testing. Until results arrive, we remain in informed anticipation. PDE5 inhibitors may be one of the most interesting drug repurposing stories in modern medicine, and a reminder that answers to big questions can hide in unexpected places. Subscribe for more evidence-based longevity content.